Pharmacodynamics, effective, affordable healthcare.
All right, I want to move into diagnosis. So if a man is experiencing erectile dysfunction, how does he go about figuring out if it's a psychological thing, if it's a physical thing? What should he do?
Very important that we ask the man, now when do you have a problem with your erections? And he might say, well, when I'm with my partner, I can't get it up or I can't keep my erection.
Yeah.
And then I'll immediately ask him, now when you're on your own, when you self-stimulate or masturbate, can you get an erection then? And then they would say to you, yes, but I can. Obviously that would show you that this is situational, not when he's with himself, but when he's with a partner. So that is more towards then more a psychological problem, like performance anxiety, worry, stress, depression, all of these things. Another question that we also ask guys is, do you still get night and early morning erections? This is part of our sleep pattern when we are in what we call REM or rapid eye movement sleep. All men get erections. The theory is it is to oxygenate the tissue in the penis, the spongy tissue that should be healthy. So a penis that is flaccid and not in the erect state actually lack in enough blood supply or good oxygen to the penis. And that is how the body keeps the penis healthy. Now again, if the guy says, but I wake up with early morning erections and they are quite good in quality, but when I'm with a partner I can't get erections, again it shows us that it's more a psychological problem, because I mean it's the same blood supply, the same nerve conduction, the same hormones. So we want to sort of first sort out, is it a major or firstly a psychological problem, or is it more than a medical problem? Although we know that mostly it is medical problems.
So on the flip side, if it's a medical problem, then you would never experience an erection. Is that true?
Well, in all circumstances, you will have difficulty getting the erection and keeping the erection. So that helps us. But obviously, we also then ask about the risk factors, the lifestyle of the patient. Is he smoking? Is he drinking excessively? And then we further make sure that he hasn't got diabetes or high blood pressure or a cholesterol that's high, and people might have a combination of that. You know, we get these guys with what we call in South Africa the boop, but they've got a waist circumference that is more than it should be, because they suffer from what we call the metabolic syndrome. Now the metabolic syndrome is a waist circumference in men that's more than 94 centimeters, and then a guy that has problem with his blood sugar, we also call it insulin resistance, so he might be pre-diabetic, and a guy who's got problems with blood pressure and cholesterol. And this together is known as the metabolic syndrome. And these guys are not healthy, and they are time bombs ticking. And one of the things that happen is they also then present with erectile dysfunction. So this is the amazing thing, that when people come to a doctor complaining of an erection problem, this is actually what we call a marker or a warning for perhaps bad health, and as we say, a marker for cardiovascular disease. Research has been done and shown us that a man can complain about an erection problem 2 to 5 years before he's going to get his myocardial infarction or heart attack. So isn't it amazing that a man's penis can sort of warn him about his health?
So erectile dysfunction for medical purposes can often be a result of an unhealthy lifestyle, a warning sign for something that may happen.
Absolutely. But then in older men, there's also prostate cancer, and if prostate cancer is detected early, then the cure rate is quite high. And what they do is they do what we call a radical prostatectomy. So they remove the prostate and 2 other glands close to the prostate gland. Now you cannot but do some damage to the nerves, to the penis, when you remove the prostate with a radical prostatectomy. So we also know that men that had radical prostatectomies for their early cancers will suffer from erectile dysfunction. Up to 50% of these men can suffer from erectile dysfunction. Although they try and preserve the nerves, they still have problems with erections.
Do you often find that men will wait a while before consulting a doctor if they have erectile dysfunction? How long do men usually wait before seeking
Now,
medical
that's
help?
sad, but it can take 6 months to a year. Men might just say, I'm not going to discuss this with a doctor. I feel shy about it, or I'm just getting older. And it's often the partner, especially if they're in a long-standing committed relationship, that will complain and say, go see the doctor.
Yeah.
So wonderful that at least partners often, is like a health advocate for the man.
Right. Is there a quick questionnaire men can complete to determine whether or not they should see a doctor?
We have what we call the IIEF-5, or the SHIM score, which is actually 5 questions, and these questionnaires are available usually at doctors' offices, and sometimes on websites, where you can just complete the questionnaire, the 5 questions, and that would give you an indication of an erectile dysfunction, also the degree of your erectile dysfunction.
What kind of questions are on the questionnaire?
It would be like, do you still get your early morning erections? When you try and get an erection, or when you want to make love, be intimate, do you have problems getting an erection? Do you have problems keeping an erection?
So
Those
the
are the
things we've been
questions.
speaking about.
Absolutely.
Pharma Dynamics, effective, affordable healthcare.